Hey guys, welcome back to our channel Medphonics Talks. Today we are going to start a new topic. I hope you have seen general anatomy before. Today we are going to start about the osteology. Osteology I told you yesterday, right? The study of bones and structures. So today you can see that I have written something on my board. You can see os and osteon, right? So we are going to talk about the nomenclature of the bone now. If you're taking your anatomy text, you can see they're using with os, the word os. Os is a Latin word meaning bone, okay? And osteon means it is a Greek word which is also meaning as a bone. And I will talk about the os now. So you have heard maybe about the ossification, right? Ossification means that ossification, formation. So fication means formation, ossification means the formation of bone. Like that, os means bone. This os derived from Latin and the osteon derived from the Greek word. So I will talk about the bone now. You know that bone is a very strongest substance in our body, right? Yes, it is one of the toughest part in our body. You already know that the most toughest is the enamel. After enamel, maybe we can tell the bone is the next hardest substance in our body. So you know that there are 206 bones are there, some 12 ribs. That we know many of about the bones and the basics of bones. So we can study about the general anatomy now. Then later on lectures we can take about each and every topic. I will explain humerus, radius, ulna, and we will talk about like that. So now I'm going to talk about the bones and the basics, and we will talk about the how the bones like skeletal system is divided, what are the type of skeleton, then what are the types of bones and the joints, everything we will cover here. So you can see that I have written something here, and I told that bone is the toughest part of our body, and this bone, we already know that bone is made of calcium and phosphorus, right? So you can see here the calcium is in our bone, which is around 97%. In a bone, 97% is consisted of calcium and phosphorus. Always remember 97%. And inorganic calcium salt is calcium hydroxyapatite is okay. And I hope you understand, inorganic calcium salt is calcium hydroxyapatite. So the inorganic calcium salt which is present in the bone is calcium hydroxyapatite. If I'm going to put the bone in an acid, okay, if I'm going to put the bone in an acid by removing the calcium, it will be so flexible, and I can make a knot with that bone. I hope you understand. Okay, if even the human body, we know that bone is so hardest, right? Then we might know that if the bone is so hard, then something is giving this hardness to the bone. If I'm going to remove them and I'm going to weaken them, then definitely they will come to their weakest side. Like if I'm going to remove the calcium and I'm keeping this bone inside the acid, it will be more flexible than the rigid one, and this flexibility causing the bone to like a tie. If I am going to take that bone after I put in the acid, and if I am trying to tie it, it will create a knot. So next we can go and study about the peculiarities of bones, or what all are the uses of bones, or what are the functions of bones. We know that the bones are so hardest, so definitely it will give a rigid posture to our body, right? It will maintain the posture in our body, and it also helps to maintain the backbone posture. If a human is standing, if a person is standing, if there is suppose if any kind of any malfunctions are there, then there will be some false walkings will be there. In abnormal gait will be there. Gait means a walking style. So abnormal backbone generation will be there. There are so many kind of clinical manifestations towards this bone and their formation. Then we know that the rib cage, right? Rib is having in the thoracic region. So this ribs will protect the internal organs. So it will also act as a protective shield. Also skull will protect the organ, which is a very, very, very important organ, brain. This brain is covered by or supported or protected by the skull, which is also a bone. And next is, I have already told, 97% of this bone is formed by calcium and phosphorus. So next main function is they are giving attachment to the muscles. So I can move if I'm teaching now, I can move my arms, I can move my fingers, everything, right? This all happens because this skeleton is connected with the muscles, and these muscles will help to move this bone, and this movement of this bones causing the external features. So I can tell you, or I can use my arms and legs to teach you. Now we are going to talk about the next topic. It's not a next topic, it is a classification of bones. Okay, this is subtopic. So you can see there are different types of classification according to, first one I am going to start according to the shape. We can classify the bones according to their shape. So how we can identify the bones? This is a main objective of this section. So there are different types of bones according to the classification, according to the shape here. First type of bones are long bones. They will be long. As you all know that the long bones mean that they will be long in their size or structure. So long bones, you know that there are different types of long bones, like humerus in my arms, hand, humerus, then my femur, tibia, fibula, radius, ulna. These bones are long bones. Next one is short bones, which are short in size. Here we have wrist bones like carpals, then metacarpals, phalanges, then my tarsals, metatarsals, and phalanges. These are short bones. Next one is flat bones. Their surface will be flat. You all know that, right? In your class 11, you have studied flat bones. Flat bones, give me one example. Scapula, then skull, sternum. These are flat bones. Their surface is flat. Then next one is irregular bone. Their shape, size, everything will be different, or we can't distinguish between the one bone and the another bone, because they will be having special character by their own. Like cervical vertebra number 1 and cervical vertebra number 2, which is situated in the neck. They are having different structures. If they are comparing each other, they are having irregular structures. These bones are called as irregular bones. Next one is pneumatic bones. Out of this all, you have to focus on this pneumatic bones and sesamoid bones more. Pneumatic bones, I will give you one abbreviation here. FEMS. FEMS, you can learn as FEMS. Let it be there. I will tell you about the pneumatic bones now. You know that the birds can fly, right? Why? Because their bones are they are having less weight than the human skeleton, right? So they are having weightless bones. Because of this weightless characteristic, they can float on the air, right? They are having pneumatic spaces or hollow spaces inside the bone, causing they can float in the air. In the same way, human body also having 4 main pneumatic bones. FEMS: frontal, ethmoid, maxillary maxillary and sphenoid. These 4 bones are weightless than compared to other. So I am taking this ethmoid or maxillary or sphenoid or frontal. So I am going to take that bone and I am throwing from a building. It will float in the air and slowly they will fall on the ground. If I am going to take the radius or ulna and I am throwing, it will definitely come to the ground very faster than this FEMS: frontal, ethmoid, maxillary, and sphenoid. Next type of bone is sesamoid bones. Sesamoid bones, this is very important for a NEET PG. Very important, NEET PG. Sesamoid bones are the bones. They are a type of bones which they are having a special character. These bones forms only after the birth. Only after the birth. The main example for the sesamoid bone is patella. Patella, pisiform, which is a carpal bone. Carpals, you know that carpals in our wrist. Carpal bones, sesamoid bone. This is one of example for sesamoid bone. These sesamoid bones form after the birth, because when the baby is born, after the birth, the baby will start to cry, right? Suppose this is a leg of that baby. So the baby is going to cry now. So when the baby is crying, they will be having tendons under the skin, right? So this is my skin and this is a tendon. So when the baby is crying and they are moving their arms so fastly, this skin and this tendon will rub, right? This rubbing causes friction between the skin and the tendon, and this tendon will harden themselves and this tendon will form the bone itself. These type of bones are called sesamoid bones. And this is, you know that this is patella. This is the patella. This patella will form after the birth of the baby, by which if the baby is crying and they are moving their arms and legs, everything vigorously, this causing rubbing and the tendon hardness to form the bone. Next type of classification of bone is accessory bones or supernumerary bones. These bones are special bones like sutures in our skull. Sutures, these are then the ribs, and these type of bones are known as accessory bones. Next, we are going to talk about the classification of bones. Now we have already discussed about the classification of bones according to the shape. Next, we are going to talk about according to the developmental classification. First one is membrane bones. Then next is somatic bones. Okay, they are having subclasses on the membrane bones and the somatic bones. Membrane bones subclassifications are cartilaginous bones and membrano-cartilaginous bones, and for somatic bones the subclass is visceral bones. So you can see that membranous bones or membrane bones, these bones will form and ossify. I have told, right? Ossify means formation of the bone, or ossification means formation of the bone. The bone will be formed from the membrane. The name itself says about that. Membrane bones ossify from the membrane. And next subclass is the cartilaginous bone, and these cartilaginous bones will ossify from cartilage, and these forms most of the long bones like humor, femur. These kind of bones will form. Startingly they will be seen as a cartilage, and this cartilage will form to the bone. Next one is a membrano-cartilaginous bone. These membrano-cartilaginous bones will partially ossify from the membrane and the partially will ossify from the cartilaginous bones. Study motes, M-O-T-S. Motes is mandible, occipital, temporal and sphenoid. These four bones are membrano-cartilaginous bones. They will initially start from, partially they will form from the membrane and partially they will form from the cartilage. These bones are motes: mandible, occipital, temporal and sphenoid. Don't forget fems. Fems are pneumatic bones: frontal, ethmoid, maxillary and sphenoid. Next is somatic bone. Most of the bones in our body are somatic. Subclass is visceral bones. Visceral means that internal organs. Visceral means organs. Okay, so these bones are something related to the visceral organs, right? So visceral bones will form from the pharyngeal arches. Pharyngeal arches, you will study about that in embryology. These bones will form from the pharyngeal arches. Example: hyoids, ear ossicles. Ear ossicles, you know that, incus, stapes and malleus, incus, stapes. These are ear ossicles. These small bones are also formed from the pharyngeal arch. Next, we are going to talk about the another classification. First classification we have already completed, the classification according to the shape. Next one was the formation, like how it is formed, like cartilaginous, membranous and all. Next, we are going to talk about the regional classification. I have told, right, in the last video, anatomy, we told regional anatomy. We are studying according to the regions of our body. Like in regional classification, we know that the bones, total count of bones, there are 206 bones are there. Out of this 206 bones, we can divide it apparently to two: axial and appendicular skeleton. Axial, there are about 80 bones, and appendicular, there are about 126 bones. Just leave about this axial, we can talk about appendicular right now. Appendicular bones, we know that appendicular means that the extremities or the limb. Okay, these arms, legs, these bones are extremities. So I have upper limb. I have two upper limb, right? One upper limb and one upper limb, two upper limb. Then next one is one lower limb and again one lower limb. We can give one space for some other, we will talk about that later. So in upper limb I am having 30 bones. Each limb I am having 30 bones. Okay, each limb I am having 30 bones. Here 30 bones. Lower limb also 30 bones. Next lower limb also 30 bones. Then 30, 30, 60 and 30, 30, 60, 60 plus 60, 126. 6 bones are left, let it be there. So we can talk about the upper limb, right? So upper limb I am having 30 bones and lower limb I am having 30 bones. Like so, upper limb we are going to talk about upper limb right now. I am having one humerus here. Okay, one humerus, one radius and one ulna. Radius 1, ulna 1. Then I am having 8 carpels here. 8 carpels here. 8 carpels. Then metacarpals I am having 5. 1, 2, 3, 4 and 5. Then I am having 14 phalanges. 14 phalanges here. 1, 2, 3, 1, 2, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. 14 phalanges I am having. So this 14 plus 5 plus 1 plus 1 plus 1 and plus 8, this all will together having 30 bones. And one upper limb is having 30 bone. The next upper limb is having 30 bone. 30 plus 30, 60. Which means that the total upper limb I am having, for both the upper limb I am having 60 bones. So now we can talk about the lower limb right now. Lower limb I am having one lower limb, one leg I am having 30 bones. The both limbs they are having 60 bones. Now we will talk about that now. One femur I am having, tibia, one tibia, fibula, one fibula, femur, tibia, fibula. They resembles same like humerus, radius, ulna. Okay. Then after femur, tibia, fibula, I am having tarsals. Here I am having carpals and in the legs I am having tarsals. Tarsals I am having 7. Tarsals I am having 7. Then metatarsals I am having 5. Okay. Then phalanges like same in the hand I am having 14 phalanges. Now we can see 1 plus 1 plus 1 plus 7, total 10, 24 plus 5, 29, right? 1 where it go? Lower limb I am having 30 bones, right? So here comes the role of patella, which is your knee joint, and this is patella. Patella is the one bone that we have missed here. Then total we are having lower limb, we are having 30 bones. Then 30 plus 30, both legs I am having 60, and this 60 plus 60, I will have 120 bones. Now we will talk about the 6 bones right now. 6. Okay, 6 we can classify into 2. I am not teaching you max, don't worry. I am having 6 bones, 120, I hope you understand, the all limbs together 120 and the balance 6 we are talking now. This 6 I am having pectoral girdle, and this 6. Next is pelvic girdle. So what is pelvic girdle and what is pectoral girdle? Pectoral girdle I am having in the shoulder side, which will form the shoulder joint, and the pelvic girdle will be on my hip, forming the hip joint. So who all will be in the pectoral girdle? I will show you. Suppose this is a scapula, and clavicle. This scapula and the clavicle will form one girdle, and there are one scapula, one clavicle. This is my right side, right? This is my right side. This I am having one clavicle and one scapula. Scapula, one, clavicle, one. Here comes the 2. I'm only having the right side. No, I'm also having the left side, right? So definitely next S1, then C1, total 4. So pectoral girdle, there are 4 bones. Then what about the pelvic? It is easy, right? 4 already formed here. There is only 6. Then balance 2, which will be on the pelvic girdle. On my right side, one hip joint, and my left side, one hip joint, and this both will form hip joint. This left and right hip joint will form the pelvic girdle. So how many total appendicular are there? 126 appendicular are there. 30 on my upper limb, both upper limb 60, then lower limb 30, then both lower limb 60, causing 120. Then these 2 girdles 126. Next we are going to talk about the axial skeleton. Now, what is axial? Axial means the center part, right? You know that in our maths we have learned axis, right? Axis means the central part. So, this axial skeleton which is forming the center of our body. I have told the extremities. Extremities means extreme side. I have told about the extreme side. Now we are going to talk about the axial skeleton. Axial skeleton having 2 parts. The skull, and next part is the thorax. Skull and thorax. Also the vertebral column. Okay, let it be in the skull itself. Skull and thorax. So in the skull there are about 14 facial bones. 14 facial bones. On my face there are 14 bones are there. Then my cranium. Cranium is having 8 bones. 8 cranial bones are there. Then, have you heard about ear ossicles? Ear ossicles, malleus, incus and stapes. Left side I am having or right side I am having malleus, incus and stapes. 3 bones are here. Then the right side or left side I am having again 3 bones, and 3 plus 3, 6. So 6 ear ossicles are there. One small bone is here in the throat. This is known as hyoid bone. Hyoid bone will be also in the class of skull part or the axial skeleton. Then this hyoid bone is also an example for super bone. Have you remember that the bone which we are talk about the shape and size. We have talked the first one like long bone, short bone. So the hyoid bone is a subclass of developmental classification. You remember in the developmental classification there is a class which is somatic, and in the somatic there is a subclass called visceral bones. These visceral bones, we have example hyoid bone. Also it is an they are having another examples, but one of the example is hyoid bone. Then out of this, another vertebral column is there in the skull part. There are around 26 vertebral column. Don't worry, we will talk about this every vertebra and everything, each and every bones later. So overall, I'm having in the skull, these all are belongs to the axial skeleton here. Then now we are going to talk about the thorax. You know that thorax, one bone is there which is dagger shaped, right? It is like a dagger. What is dagger? Dagger will be looking like this, like a knife. Okay, this bone is situated in the center of the chest. This bone is known as sternum, and sternum having one bone. This one sternum is there. Then you know that sternum is connected with the, or articulated or making a joint with the ribs. One side I'm having 12 ribs and another side I'm having 12 ribs. So 12 plus 12, there are 24 ribs are there. Ribs. I'm having 24. So 24 plus 1, 25. Then 26, this 8, 1, 6, 14, all together we are having 80 axial skeleton. So the appendicular skeleton 126 and the axial skeleton 80, all together I am having 206. This classification is regional classification according to the axial region and the appendicular region. Now we are going to take the other last part. I hope you will enjoy this part because this is all about clinical anatomy. Now we are going to talk about some clinics here. First one is cleidocranial dystosis. Next is fracture. Third one is hangman fracture. Fourth is rickets. Then bone marrow biopsy. Then osteoporosis, and some images here. I will tell you what about that. Cleidocranial dystosis. Cleidocranial dystosis is a condition. You will study about more about this in your orthopedics, and in your like anatomy we will talk about clavicle, but there is not too much, but you can study about this. Cleidocranial dystosis is a genetic rare disorder. Genetic rare disorder means that it will happen genetically. It is not by any after of birth, before birth, or chromosomal abnormality, whatever it is. Cleidocranial dystosis is a condition by which the patient or the individual will not have clavicle there. So this condition will cause the shoulders to clench up like this, and this causing cleidocranial dystosis, absence of clavicle. Next one is fracture. Let it be there. We will talk about that later. Third one is hangman fracture. Hangman fracture. The name itself says that hangman. Hangman means we are having, suppose if an individual having any like mental pressure and someone had tried to suicide, and this causing the breakage of their C1, C2 vertebra. What is C1, C2 vertebra? We will talk about that. C1 and C2 is a two cervical vertebra. C1 is the first vertebra and second is a C2. When an individual tried to suicide or hang on a rope, suddenly the neck got slip and C2 is covered with the C1. When someone will hang on the rope, suddenly the C1 and C2 will cause a break, and this breaking will cause spinal cord to pressurize themselves towards the bones. So this spinal cord injury will causing the death of the patient, which means that innervation, right? This spinal cord will supply to the heart everything. When suddenly it got pressure, or it got pressure by some other external something like that, then this innervation will not happen properly, just causing the heart, lungs, then all internal organs damage according to the hangman fracture. Then next is rickets. Rickets is you already know that rickets, beriberi, these all are kind of deficiencies, right? Vitamin deficiency, vitamin D deficiency. Vitamin D deficiency will cause rickets, and this will cause the lower limb to form a C-shaped bones, right? This is a rickets. The next one is bone marrow biopsy. You know that biopsy, the term biopsy means that we are going to take something from something. We are taking something from something. So if I am having a tumor, suppose my hand is having some tumor or something, whatever, the doctor is not sure about that. So the doctor will ask you to take the biopsy. So this biopsy will help to take this part of the cells from there, and I will give it to laboratory, and this laboratory test will show whatever it is, maybe tumor, cancer, carcinoma, whatever it is. This is biopsy. So bone marrow biopsy means that inside the bone there is marrow, right? So if I'm taking bone marrow biopsy means that I will take, or the doctor will take, biopsy of the bone, which means that the doctor will insert a very long needle, thick needle inside the bone, and they will suck or aspirate. Aspirate means taking out or aspirate the bone marrow, and he or she will give this to the lab for identifying the tumor or whatever happened inside your bone marrow. Next is osteoporosis. Remember, os means bone. Porosis means pore, right? So the pores in the bone, this condition is osteoporosis, which is also like most of the old age individual will have this problem due to the calcium deficiency and all. Now we can talk about the fracture. There are 4 basic fractures in your BD Chaurasia: spiral fracture, horizontal, oblique, and compound or open fracture. This you can see here, right? It's like a chisel shaped. These fractures are known as spiral fracture. Next is horizontal, which will be a clean cut. If I am taking the chalk like this, and chalk is going to break. See, if I'm going to break this chalk, you can see here, this is a horizontal because it is so clear. You can see 2 bones detached by each other. This type of fracture is known as horizontal fracture. Next one is oblique fracture. Oblique fracture will be twisting and breaking, this causing 2 sides to elongate each other. See, 2 sides are elongated each other. These are oblique fracture. Next one is open or compound fracture. Suppose this is a hip joint, this is a hip joint, and this is a femur. So someone got hip dislocation and together fracture. So the hip is dislocated and the fracture part will be removed towards each other, like opposite to each other, not towards each other, opposite to each other. This condition is compound or open fracture. So this is all about the clinical anatomy, and I have told everything which is more basic and which is more important for your NEET preparation at your USMLE, and I have told many of the basics here. So next topic, this is all about general anatomy on your bones. Next video we will talk about the joints in your bone. What is joint? Joint is they are joining 2 bones or whatever it is, something is joining each other. These are joint. So in the next video we will talk about the joints. So stay tuned. I hope you enjoyed this session. I hope you will study more about this. Next video or coming Saturday, Sunday, I will put every topics question discussion according to your NEET and your AVD Chaurasia, every sources I am having. So I hope you have enjoyed this video. I will make you to study more because I am also a medical student. I can understand how tough is medicine. So I'm so good in anatomy. So I'm having this YouTube channel to help you all. I hope everyone had been subscribed and all should watch my videos. Thank you.